you walk in, we wanted to design it such that the color scheme and the layout of the place would make you feel comfortable. A lot of natural light, plants, different types of pictures, and fun kind of things like a play area for the kids. And each exam room, again, is designed in a different way, different color scheme, different picture. Each of them have their classic exam room table, a sink where the doctor can wash his hands, and an area where the client can sit down with their pet and talk with the doctor. We have 7 exam rooms here, the last one being the pet visitation room, or also used for when people come in to euthanize their pets. So that's the 7th and last exam room. So this is our main treatment area where all the action takes place. And it's nice because you can look right into the doctor's office here where we work on our paperwork, which is endless amounts of paperwork, and we have our books and all of our materials to work on the paper side of the hospital patient. And they can look out, and when they see a triage, they can immediately come to attend to the triage. And this is Packer. Packer is our mascot at the hospital. She's so well known here that when people come in, they ask for her, actually, if they've been in here more than once. We have a picture of her, a photo of her up on the wall. She'll go out when we've had some people that are crying out in the waiting room, and she's gone up to them, jumped up on the bench and sat near them even. So she's got a huge job here, walking around all day and taking care of everything. So. They're all taken care of here, there's 4 different spots, and this would be similar to if you would go in the emergency room. But you can see in effect that these are the 4 different stations where 4 different doctors can look at an animal and make a decision. First of all, can they be put away in a cage? And they're going to need further work being done, maybe blood work, maybe x-rays, things like this. Or can they go out and wait with the owner because they're not so critical? Or are they critical enough that we need to work on them right now and they need to be hospitalized and brought into our intensive care unit here? We have the revolving cabinets here, which are quite interesting. A lot of people really appreciate this. This is all the IV drugs in an alphabetical order, so we can just rotate this around very quickly from anywhere you're working on the 4 stations and grab an IV drug that's necessary. But if you look in the treatment area, it's the major emergency area, so everything is available at our fingertips. If you look over to the middle area station, we have the defibrillator, airway suctioning. The cart can actually be maneuvered to any of the 4 stations. It's on wheels. It has in it IV catheters, IV drugs that need for immediate emergencies, tubes that you can put down to get into the airway of a pet that is having a difficulty breathing. We even have instruments where you can go into the chest if necessary, if they have actually passed on and we're trying to bring them back to life and performing CPR on them. We have a full service laboratory here. We can do every blood test, urine test, fecal test that is necessary to do diagnostics right in-house. We can do it at that minute and have results within 20 minutes to a half an hour. We also have a full-service blood bank here. So if you look into our refrigerator, we have blood for dogs and for cats, and we can even get blood for birds or for rabbits if it's necessary. So we have a blood donation program where we have about 50 dogs and about 20 cats that are available at moment's notice to come in and donate, and then we keep the blood in the hospital And when we use that for a pet, we call up the next donor. They will donate blood about 4 times a year. They'll have to come in. With each donation, they get a free blood screening, full blood screening and physical exam here at the hospital once a year. Every time they donate, they get a free bag of dog food, and they get a $25 credit towards emergency services at the hospital. So it's a very nice program for cats and dogs under the age of 10 years of age, young, healthy pets. So that's available at our hospital. We have a full X-ray department, which is digitalized, which is quite amazing. So all of our X-rays can be taken, and within 3 seconds, the film is available and we can look at it. This here is our procedures room. This is where we do all the endoscopy. We'll suture up lacerations in this room, and any short procedures that don't need sterile surgery. Over here is a very popular room. This is our ultrasound room where we perform all our ultrasounds and echocardiograms. So we look at the abdomen, or we look at the chest cavity to look at the heart, or other areas, soft tissue areas, like look at abscesses or fluid-filled cavities. But this is a very popular room. This is our outpatient pharmacy. So almost every medication that we're going to send home with the patient is available here. So before the patient goes home, or our outpatients, everything is filled right in-house. So it makes it comfortable for the patient. They don't have to go to an outside pharmacy. This is the surgery area. Nice again, because it comes right off the main area, treatment area. As you walk into the surgery room, we have 2 prep areas. One patient can be prepped on one table and another one on the other table at the same time to go into 2 different surgery rooms. On the left-hand side is our orthopedic room. So that's where Dr. Brodecka does all the orthopedic surgeries. The right side is used for all soft tissue surgery. That's going into the abdomen, taking out foreign bodies, looking for a tumor to take out, removing the spleen, things like this. This is our ICU unit, which is our most important room in the hospital. This is where all our inpatients are kept. And as you see, we have smaller cages for smaller animals. We have oxygen cages, animals requiring oxygen therapy. We have patients that are on many different pumps. In a separate room over here you see is for exotics. It's called the bird area, but it's used for all the birds, the guinea pigs, the rabbits, the reptiles are all kept in a separate room that has its own ventilation system and has glass around the whole thing so we can see them at all times. While we're on the regular ICU unit, we can see into the exotics. The other room on the far end is where we keep our isolated pets, and those are pets with upper respiratory diseases, parvovirus, leptospirosis, anything that's infectious that they have to gown up and put gloves on to go into that room. And it has its separate ventilation system that keeps those animals, the air different in that area from this area in the ICU. food preparation area where we prepare all the food for the animals. And everything is made specially. There's rabbit diets here, there's diets for guinea pigs, there's diets for birds, and there's diets for dogs and cats. In the same area is the tub where everybody is bathed before they go home. And then the last place is where we can take pets out. It's all fenced in and protected, so all the pets can be taken out, walked out individually every 6 hours.
Pets, Mecca, Milwaukee Emergency Center for Animals, Mecca.